Your patients want you involved in their overall health, and you can be. By offering blood pressure screenings at every visit, dentists can help detect early signs of heart disease. The American Heart Association's Healthy Smiles, Healthy Hearts initiative, in collaboration with Delta Dental, gives you the tools to do just that. Learn more at heart.org/healthy smiles. That's heart.org/healthy smiles. Hey, everybody, it is Kevin Henry, editor-in-chief for drbicuspid.com. Thanks so much for joining us for another podcast, and I'm thrilled to have on today Dr. Kelly Daly. Dr. Daly, how are you doing?
I'm doing well. I'm thrilled to be here. Thank you for having me.
I'm so glad to have you on. I'm looking forward to the topic today. But before we dive into dental fear and patients, I'd just love to know our audience a little bit more about you.
Sure. I am a research scientist and a clinical psychologist at New York University's College of Dentistry. I do a lot of research about health in general, kind of best practices, evidence-based interventions. So the things that we know are really effective in treating primarily different mental health disorders. And I also teach some behavioral science classes to dental students. So things like bedside manner, interpersonal communication, and, patient change.
Well, thanks for touching that next generation of dentists and dental team members. That is awesome. I also know you're one of the minds behind the Dental Fearless Project. Tell me a little bit about that. What caused it and what can we learn from it?
Sure. Dental fear is actually extremely common. There are some misconceptions around this. Lots of dentists I initially meet and work with think, oh, there really isn't any of that in my practice. I don't see it. And I think one of the most kind of pervasive misconceptions out there about anxiety is that it's always visible, right? So I notice, somebody's hand shaking, or there might be a tremor in their voice, or they might be sweaty. And a lot of dental fear, I would say, is really invisible. So people are kind of catastrophizing in their head, sitting there freaking out. But they maintain a pretty calm demeanor, so it's not very noticeable. And the research, is kind of all over the place, but we know at least 1 in 5 to 3 in 4 people have some degree of dental fear. And for 1 in 5, at least, it seems to be pretty impairing. And that can mean anything from obsessing and kind of thinking about worst case scenario every night for an entire week until your dentist appointment, or just kind of abject terror to the point of not go, right? Canceling repeatedly, not being able to get there. So it's kind of this like really pervasive silent fear that's often mocked and we make light of. The media portrays dentists, I'm sure, in a very unfriendly light often. But what I do is really based on how do we get effective treatments, so effective mental health treatments that we know are really helpful to people into more hands. How do we make them more accessible, reduce some of those barriers to, seeing a really expensive, well-trained psychologist who has expertise in a certain thing. So given that, there's just a lot of people who we know could benefit, and we do have really good randomized clinical trials for dental fear, we thought, how do we take some of the knowledge we have from all these treatments that have done really, really well and make it more available to people? So we leverage technology. There's a lot of more recent research that shows that some really basic cognitive behavioral therapy pieces. So you can think of it as, changing what you do, what you think, or what you feel, right, in a situation can be learned via mobile apps. So we created a 2-step process. I think the app is really helpful in, helping people get a handle on how they communicate with the dentist, right? What is your behavior like? Dentists can't read minds, neither can psychologists. How you communicate with the dentist, how you can kind of express yourself and your fears, what you can do to calm some of that physiological arousal that stops, and how do you shape your thoughts so they don't spiral out of control. So the app is one piece, and then we do a one-on-one kind of individualized session on telehealth for people who really need more than that.
I love that. And is this something that you all see dentists and team members reaching out to patients ahead of time with the app, or is it something that's kind of organic with how the app and how you learn about how to handle dental fears should be for the patient?
Absolutely. So initially, it's funny, pre-COVID, we had a model where we were really working hand in glove with dentists. And we were actually doing a lot of in-person treatment in operatories, which, is somewhat disruptive. um, and COVID really forced an interesting pivot because all of a sudden, a lot of mental health care providers had to figure out how to deliver things via telehealth, via a screen, and still try to emulate some of that realism you get from the exposure in a specific situation. So there was a lot of really smart research coming out about adaptation. And we realized that, you know what, we can actually do a lot of this remotely. And dentists we still have in partnership, but they're acting more as referral partners right now.
Okay.
So, recommending the app or contact with our team to their patients who are fearful or people who even call who are kind of on the fence about making an appointment. Every so often, some of the front desk people will have conversations with people who are nervous and anxious.
Yeah, in the research before we did this podcast, I saw that fear shows itself in cancellations, no shows, things like that as well. That sometimes it's just a matter of getting ahead of that and trying to make sure that the patient is confident enough to come in the practice. I mean, is it that simple sometimes?
Yes, it is. I think so. What the patient really needs is kind of a series of corrective experiences that challenge those catastrophic thoughts that something terrible is going to happen. We know that people who are more prone toward anxiety tend to discount those. So when things go well, they find a reason that it going well was the aberration, right? Not the catastrophe. So there's a little bit of kind of cognitive shaping that I think is really, really helpful that, mental health care providers can do that I think this app is really successful at. But thinking as the dentist as well, I think something, you guys can be aware of is if this is somebody who's really scared, even if today goes really well, they're still likely going to be apprehensive, right? They need repeated kind of trials and experiences to see that they're safe here and things go okay. So I think even your awareness of that can help you kind of communicate in a certain way and think about the way the appointment's set up and what you say at the end to help that patient feel more comfortable. But yes, cancellations avoidance are huge. They lead to, prolonged complications in oral health, quality of life, and a lot of money lost actually on dental businesses' part.
So we know that whenever the patient walks into the practice, so often the dentist is not the first point of contact. It's the front office, it's a dental assistant, whatever it might be. How important is it for the team to have these kind of skills to help lower the risk of fear as well?
I think it's super important. I would say the communication is, kind of the single most important skill that everybody in your practice can really kind of develop and be excellent at. So, communicating, being validating. And there's so many, I've worked with so many wonderful dental assistants and hygienists who, they'll say things like, yeah, I was afraid of the dentist too before I got here. Things that really make the patient feel seen and validated and normalize that "Well, this is a really common experience." I've worked with so many patients who say things like, "How am I in my 50s and this is still my problem? Like I'm a child." They're very hard on themselves. And I think just normalizing, yeah, a lot of people are afraid and that's okay. And you're here is just so much more powerful than people would ever anticipate.
If in the middle of a procedure something happens and that fear mechanism kicks in, is there a way or a tip you might provide to help lower that so that the rest of the procedure can actually happen?
Yeah. So, what we know about fear is, there's lots of physiological arousal. So, if you can take a moment to pause and give that person an opportunity to say, hey, why don't you take, like three really calming deep breaths for you so you can kind of reset. And I want you to remember that, you're really in control here, right? You came to see me. This is your visit, right? You're telling me it's okay to go. You're telling me it's okay to do this treatment. Because what we see a lot of the time is kind of this loss of autonomy, and people feel really, really powerless. And that really exacerbates fear. And if you can kind of remind them, hey, we're in this together, right? I'm not doing this thing on you. This is a partnership. You're calling the shots. That can be extremely helpful in allowing that person to feel like, okay, I have some decision making power here. I'm not victim to whatever happens. This person acknowledges and kind of validates and respects me. And that sometimes can be enough, especially if you're seeing that they're getting really fearful.
We know sometimes the schedule in the dental practice can get a little weird. And if we have a patient that needs that extra assurance or extra moment to collect themselves, it may cause the rest of the day to run a little bit late. A, is that okay? And B, is it okay to share that with other patients why you're running late?
Say yes. You don't want to do it so extensively that you're hours behind, right? But I think if you take an extra 5 minutes and that's something you acknowledge up front, you are marketing yourself as somebody who really cares about their patients. So I think a lot of people would be kind of heartened to hear that, right? you know what, the dentist is running a little bit late here because we're a practice where we really cater to, making sure people feel comfortable with their treatment and not, not really perpetuating fear and anxiety. I think that, I know there's a fabulous dentist I've worked with in Brooklyn, and she really markets herself toward people who are fearful and anxious. And she has that kind of extra special touch. And she staffs in a way that, there's a little bit of coverage. There's an extra hygienist or assistant. There's somebody there if she needs to take a break and she can go on to a next patient. So just making thoughtful decisions like that, kind of owning it as, we're interested in treating the whole person. We acknowledge dental fear is real and we're a practice that cares. So we're going to do things to try to make sure that everyone has the best experience. And occasionally that might be a little bit inconvenient for other people, if we're running 10 or 15 minutes late.
But the marketing of it is really key, I think. I think that's a great point for sure.
Yeah, I think it is, and I think, if you're putting your money where your mouth is and you mean it, people see that, and she has never had a problem with, kind of returning patients. Once people get there and they say, "Oh, I'm so taken care of, these people mean it, they really do care about me," she's, like, overloaded with patients, so I think it can be really successful.
Well, we've mentioned the app, and I want to make sure people know where do they learn more and how do they maybe incorporate this into what they're doing in their practice.
Yeah, that sounds great. So you can go to www.dentalfearless.com and, contact to reach out. We have a coordinator who will take that information, tell you more, get you hooked up with the app as a patient. You can also reach out there as a dentist if you have any information or you want to work with our team. Something else we do is provide continuing education credits for dental practices. So they are eligible through because one of our collaborators is there. And, it's a way to kind of get some continuing ed credits and also make sure that your practice is, really aware of that kind of invisible anxiety and other ways to find out about it, right? I would say one other really important thing for dentists is you can ask about fear. We want you to, right? Like this idea that if I bring it up, I'm going to cause it, not true at all. If you have somebody really anxious though, and you don't say anything, that's kind of what's invalidating and increases it. Whereas acknowledging it and validating it actually helps people manage.
Bringing out that elephant in the room maybe isn't such a bad thing. That's awesome.
Exactly.
Well, we're going to have the link to the website in the show notes. Very easy to find. And Dr. Daly, I've enjoyed the peek behind the curtain here. Thanks so much for your time. I really appreciate it.
Thank you for having me.
Absolutely. And thanks to all of you for listening to this episode of the DrBicuspid.com podcast. Yeah, bring out the elephant in the room. Talk about fear. See what you need to do to make sure that that patient understands you're on their side. And as Dr. Daly said, you're in this together. How do you make sure that you can get to that end goal that your patient wants and needs? Until next time, it's Kevin Henry, editor in chief for Dr. Bicuspid, signing off. And as always, wishing you nothing but success ahead.